Thank you. This is Marko Mijic. Dr. Gallian is unfortunately not able to join due to a press conference with the governor in Los Angeles that was just announced. So I will be filling in for him this morning. My name is Marko Mijic. I'm the Undersecretary at the California Health and Human Services Agency. And I am just really honored to be here with all of you. This is a really, really important topic to us at the California Health and Human Services Agency. It is something that is at the core of our mission with regards to ensuring that people with all abilities, but particularly those individuals who have both visible and non-visible disabilities, have an opportunity at employment. And I am uber grateful to two particular colleagues within our agency, Director Joe Xavier, who has led much of our work across our agency, but also across state government around looking at opportunities for us to make sure that we integrate individuals with all abilities into the workforce. And so a huge shout out to him. And then our colleagues at the Department of Social Services also, who have done a tremendous job under the leadership of Kim Johnson. What I want to spend a little bit of time talking about and look forward to the continued conversation as part of this group is really our efforts around looking at ways in which we build a healthy California for all. And that includes people, older individuals, young individuals, people of all kinds of abilities and backgrounds, because our success really is dependent on our ability to work together. Our recovery from the COVID-19 pandemic is dependent on how we come together as one people to be able to really lift ourselves out of the pandemic as a state. And so, you know, we at the California Health and Human Services Agency have spent a lot of time thinking about how do we think differently about the provision of our programs and services. And I see that Stuart and Angie and others from GovOps who've done such tremendous work around data and person-centered and agile. All those principles are front and center as we look at the recovery. And what my boss often says is that COVID-19 has been the greatest unmasker of inequities and disparities. And he also says that COVID-19 is our greatest accelerant for change. And that plays to what Angie and Stu and others are doing across state government to think differently about the provision of our programs and services so that they're more person-centered, that they meet the whole needs of people. Too often, we build programs and services based on the siloed structures of government. And what we don't do is think about how those individuals interact with government to get those services. We have folks coming to us through 5 different doors when we should be thinking about one door and ways in which we really wrap ourselves around them on the back end. And this includes people with disabilities, right? We have individuals with disabilities who are getting services from us. It is our duty and responsibility to really think about how we integrate them through our programs. And it's also our duty and responsibility to think about how we ensure that our workforce, our state workforce, our own workforce at Cal HHS in particular, is reflective of the people we serve. And that includes people with disabilities. And that's both visible and non-visible disabilities, because I think it's really important to remember that there are folks that are dealing with depression and anxiety and other things that we might not be able to see. But we have to be open to the idea that the person next to us, and nowadays it's more virtual than it is in person, might be going through things that we don't know. And so it's our duty and obligation to really think collectively as colleagues around how we lift each other up in a more meaningful way. And so, our charge to our team, and we have 12 departments and 5 offices, 34,000 employees across the state of California, is how do we create a more just, more inclusive, more diverse workforce and programs that reflect the people that we ultimately serve. And so, I'm just really humbled and honored to have the opportunity to lead with the secretary at this point in time, because we really do have a tremendous opportunity as we look ahead as part of our recovery to think differently about ways in which we do business both as a state. And I think that we all collectively have to double down on the idea of creating strong opportunities of employment for our friends, family members, and neighbors who are disabled. And so I'm just, Bobby, grateful to you and the rest of the team and all of those who are on this Zoom for really leaning in on this. And I hope that this is just not one conversation as part of this month, but that this is an ongoing conversation that we have every single month. We shouldn't just celebrate, or we shouldn't just double down on our work to make sure that everyone has the opportunity and employment, including our disabled brothers and sisters. It's also important that we do this every single day in our work. And so I'm excited to be on this, to learn from everybody else. I'm excited to learn from you, Bobby, around ways in which we can do business differently and better. And I hope that this just is, again, a beginning of a long conversation with the folks who are on this call, with our stakeholders and partners in the community on the ground who are really delivering some of these services in a more holistic way. So a huge sense of gratitude. The Secretary senses regrets that he's not able to join, but I know that his vision for what a healthy California for all looks like is amplified by the work that each of you do. And we're really just excited to be part of the conversation. So Bobby, I'll turn it back to you.
Thank you very much, Undersecretary Mustick. It was very nice of you to come in and present and be in lieu of Secretary Galley. Do you have a couple of minutes for Q&As?
Absolutely.
Great.
Marko, what are the areas that you feel like you could cover in your agency to speak to kind of get the conversation started?
Yeah, I'm happy to touch on any of the issues. We've got 12 different departments that do a breadth and depth of a variety of different things, and it's my responsibility to understand the nuances of each of those. So I'm certainly happy to engage in a variety of different topics related to the scope of our agency. And no question is a silly question. I'm certainly happy to take any question that folks have.
Well, while people are gathering up their questions, I'm going to start with mine.
Sure.
My question to you is, Undersecretary, a recently passed bill, AB 313, would require that each state agency develop its own reasonable accommodation policy for individuals with disabilities consistent with the state and federal law.
Mm-hmm.
To address request for reasonable accommodation, as the Secretary and Undersecretary of this agency, the largest agency, what will you do to ensure all departments within your jurisdiction develop and implement a reasonable accommodation policy for all the employees under the umbrella of Cal HHS?
I think that's an excellent question and a timely question, because just yesterday I convened all of the chief deputy directors within our agency to have a conversation about a variety of different topics. And this is one of the topics that we talked about. And this is going to be led by our Department of Rehabilitation. So Joe Xavier and Andy Murdoch are going to be providing technical assistance to all of our departments. And we are going to be closely engaging with the Government Operations Agency as well as our colleagues at Cal HR to make sure that we are succinct with regards to how we're implementing this important piece of legislation across state government. Obviously, we have an opportunity to lead within the California Health and Human Services Agency, and we intend to do that. And so part of our conversation yesterday was around how do you begin to map out a framework? How do you create some consistency across the various departments within our own agency? And then we'll certainly have that same conversation with Cal HR and GovOps around how we elevate that to a broader scale. And then on top of that, how do you ensure some flexibility within these policies for each of our departments based on their local conditions and the people that they serve? And so there has to be some standardization across the entirety of the agency so that we are ensuring a floor, but then we also should be encouraging our departments to think differently to align with what their needs may be within their individual departments based on the people that they have working for them. And so over the course of the next couple of weeks and months, we're going to be working with DOR and other state agencies to really think about how we complement those two principles in a more holistic way. I see another question from Rihanna around people with disabilities, particularly people with intellectual and developmental disabilities, IDD, remain one of the groups that are vaccine hesitant. And I think that this is really, this is important. And let me talk about kind of a few different things that we're doing here to make sure that we are educating folks. I think first and foremost, there is a lot of misinformation around the side effects and or benefits of vaccines, particularly in the IDD community. And so we are doubling down on being able to make sure that we have easy to understand, culturally competent, linguistically competent information that we can put out through a variety of different channels. It should not just come from the Department of Public Health, who is the true source of much of this, but we're engaging the Department of Developmental Services, the Department of Rehabilitation, other departments who have stakeholders and clients that they're serving to be able to get deeper and wider into the community. What we are most worried about is the inequities that this pandemic was fueled by, being further perpetuated by the fact that most individuals in some of these communities are not getting vaccinated, and so are going to be more likely to be infected. They're more likely to be hospitalized, and they're more likely to die as we move into the next couple of phases of the pandemic. So what has been important to us is that we get deeper and wider into the community. We look at partnership with nonprofit, community-based organization, other entities that are trusted sources that can deliver the message to individuals who are in the IDD community so that they can better understand. Everyone is going to have questions, and it's okay to judge people, but rather to sit down with them and say, how can I answer the questions that you might have about the vaccine? And what we find is when we actually sit down and we present them with the information and we answer the questions, most often people actually make their own determination and they make the decision to get vaccinated. And so part of our strategy is really making sure that people have the information, making sure that it comes from trusted messengers, and making sure that vaccines are available and accessible to all, particularly those in neighborhoods or among populations that are more disadvantaged.
Of her questions, and what can we as SDAC and other agencies do to support efforts to address public health crisis? Did you also address that?
I didn't see that. I'm sorry. I'm reading her question right now. Yeah, of course. I mean, and I think it's going to take all of you too. So I think that we would love to follow up with Bobby, and Darcy on our team is on the call about how we're doing the messaging, what we're doing about it. I think to the extent that you can push out the collateral that we've developed, and really create forums for people to engage in conversations. We're happy to bring in experts, physicians who have expertise and can answer questions. We would be happy to lean in, and we'd welcome your partnership to really think differently about how we do it. The other thing I will say is that we would love to work with you all to think about, are there other things that we could be doing differently? I think the question could be to all of you, are there things that we as an agency or a government can be doing differently? And of course, this has not been perfect. And of course, we're going to iterate and be nimble around how we do this. I hope Stuart and Angie are proud of me for using some of these fancy words, but I think that we want to iterate on kind of our efforts around how we respond to the pandemic. And so I would look to all of you to say to us, maybe there are other ways in which we can get very deeper and wider into the community.
Well, and Marko, you have, this is Susan, I'm the moderator here. You have an audience here. We are the Disability Advisory Committee representatives and EEO officers for various agencies. I think we would turn that question back to you, Tor, is do you have any advice for resources we should be looking into? Because we're like, some of us are manager level, some of us are staff level here. And we would love to know what resources we should be using to help communicate the messages, and what are the paths for us to communicate it back up the chain? Because we're supposed to be representatives from the disability community communicating to our agencies about how to make sure we're all represented.
No, that's great. And we've created a lot of information with toolkits and collateral. So I think what really needs to happen is we need to follow up with you all and get you all the information that you can push out to your departments.
That would be lovely.
The other thing that I think has been quite helpful is we have done some webinars with state agencies, like Secretary Galley recently did one with the Transportation Agency and all the managers within that agency to have a conversation around just the hesitancy question. And he, as a physician, really kind of had a fireside chat, for lack of a better term, around what it means to be vaccinated. We're also leaning in. You probably saw the Secretary sent a letter to all state employees recently, kind of emphasizing the importance of vaccines. And so I think we've developed a lot of product. I think part of the issue is we haven't gotten it out. And so I think it's on us to figure out how we get it to all of you. And we'll do that follow-up with Darcy and others to make sure that we bundle it in a way that is easily for you to disseminate and get to folks within your own departments.
When Marko, you said two things. Number one, yes, these are the people that would be great. We are the people that it would be great if you got those resources to. Right. And you can definitely send them to Bobby and Eduardo so they can put them in the distributions that come out. But the other thing is, you mentioned that a possible. So some of the SDACs have the ability, some of our DACs have the ability to set up lunch and learns. Perfect. Or to do presentations with our DAC. And I know I've done speeches for different DACs. And I know that that's an opportunity that we're always looking for people to talk, especially in agencies like yours that have knowledge that maybe we don't, that would be very useful. So if you can include in those packages, who are the people to reach out to if we're looking to have discussions amongst our SDAC or lunch and learns, that would also be great.
The follow-up question I have for the Undersecretary is one of the things that AB 313 also talked about is having parity in state services, meaning that at least 16.1%.
I guess the question to some of you is, what has worked and what hasn't worked? What would be more helpful? Are there tools that you think we should be developing to help with COVID-19 or vaccine hesitancy? Are there other things that we could be thinking differently about in terms of information? So I guess I would love the opportunity to learn from all of you. And if there are folks that could spend a little bit of time maybe sharing with me their experiences, that would be helpful for me.
I think we're in an interesting position, Mark, because we are the DAC. Jay Gallivan just said our DAC provides info in our newsletters. So our position is, as staff and in the committee, the goal is, but we do have to go through the chains of command. So that, I mean, like Jay Gallivan was saying, providing info through our newsletters, maybe talking to people individually, that's the length of the ability we have to communicate.
Sure. But each of you are within your own departments. What are you seeing within your departments? What type of hesitancy are you seeing? What type of questions are people asking? I think those are the types of things that would be helpful to me to better understand.